Can someone please discuss the 99211 CPT? I'm bringing it up now.
Okay, 99211 is defined as an office or outpatient visit for the evaluation and management of an established patient that may not require the presence of a physician. Presenting problems are minimal. 5 minutes is typically the time spent performing or supervising the service. Physicians don't typically use the 99211. It really was intended more for like a nurse or a medical assistant. Unlike other office visits, the 99211 does not have any specific key component documentation requirements. The patient has to be established. There's some degree of medical decision-making that takes place. But if a clinical need is not substantiated, you cannot bill it. And the big difference here between Medicare and other insurances, or CPT, is that CPT, the presence of a physician, is not required. And a lot of insurance companies follow that guideline. Medicare says a physician must be in the office suite, which means it's like billing incident 2. They have to be within shouting distance, not across the path at the hospital, and not by cell phone. They have to be in the office. Now, I want to give you a couple examples of when you would not use a 99211. If a patient comes in once a month for a B12, and the doctor just gives a shot and that's it, then you're billing a 96372 with the HCPCS code J3420 for the B12, and that's it. If a patient walks in with a little bottle of allergy serum and the nurse gives you a shot, there's no 99211. If you're picking up a script, dropping off a urinalysis, even if it is face-to-face, it's not a 99211. Okay, now when you can bill a 99211, if a patient is seen by a nurse because she has burning and urinary frequency, the nurse takes a quick look, focused history, reviews the medical record, has the patient go to, pee in a cup, he has an infection, shows the doctor writes a script. But it's really a very, very quick visit. If the physician requests the patient to go into the office for a blood pressure check because he has problems with hypertension, that qualifies for a 99211. If a patient calls for a visit because he has clinical indications that his blood pressure is off the map, that is clinical indication you can bill. But I know for a fact that on small little country doctors and on Cape Cod and the islands, everyone knows everybody, and patients just walk in and say, "Hey, doc, can you check my blood pressure?" That doesn't cut it, okay? So you can't bill a 99211 for that. All right, so that's very important. What I do want to stress, though, is that there are some doctors that think they can get away with this. They'll tell the nurse, do the vitals, bill a 99211 with a B12 shot. But when the insurance pays right off the copayment, you cannot do that. It is totally illegal. The physician has a contract with the insurance company, and he's breaking his contract. And if the patient doesn't pay, they're breaking their contract. And I have seen one doctor in my lifetime go to court because they didn't collect co-payments for their patients. So don't play that game. It's not worth taking that risk. So that's basically it for 99211.
I've seen that happen too, and it was really difficult to try to explain why that.
Yeah, and patients, if they get billed for it, they get angry because they'll say, "I was just in there for a shot. Why do I have to pay $25 copay?" They don't like it. So that's
and the office staff or the physician thinks they're giving you a discount. So
yeah,
by making you do that.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.